I'd like to welcome all of you to this first cricket-based webinar, where we've decided to approach things of discussing sports biobubbles and the experiences of healthcare workers that work in these bubbles. So the reason behind this is very often do we see lots of information being shared about experiences of players, etc., and even research is based that way. But no one talks about the actual individuals that's involved, that's looking after these individuals of high caliber nature, and what are they going through. And I think that's quite a vital, important aspect for us to start talking about. Before we go into the webinar, I'd just like to say thank you to a couple of scenarios here. So firstly, to WiSH, the Wits Institute of Sports. Thank you for these opportunities of webinars to help us keep informed of new developments within the sports medicine environment and all these type of things. Thank you to SASMA, the South African Sports Medicine Association, for actually associating with WiSH and endorsing the talks as well. So we appreciate that really much. And to our sponsors, the Sinolitha. Without them, this webinar would never happen. And in the background, to Dr. Robin Saggers and Nadine Peterson, who tirelessly make sure that these webinars go on, CPD points are applied for, and everyone receives their CPD certificates in the next couple of days. So thank you very much to everyone else that's involved in the background as well. It's much appreciated. Should there be any questions, dear colleagues, please put it within the Q&A chat. We will try and answer as many online. If we do not get to answering them online, we will then revert to you via email with answers on these questions. The webinar will be recorded and will be available at a later stage. So please keep a lookout for those further communications. So without further ado, I'd like to introduce our panelists that we've invited for this talk. And we've got quite an esteemed bunch of colleagues here. And it's important that we realize that they've been in bubbles for most part of the last couple of months and in and out of these type of bubbles. So firstly, I'd like to introduce you to Craig Govender. So Craig Govender is our Proteas national team physiotherapist. He's the director of the Wonder Sports Medicine Center, and he was an avid school and university-based cricketer, and that's where his passion came in. He's been involved in cricket since then and decided to pursue a career in physiotherapy, and that led him to being the Highveld Lions physiotherapist, moving on to the emerging SA team, and now with the national team as their chief physiotherapist. Next is Dr. Konrad van Hagen. So Konrad also probably needs no introduction. Konrad was the ex-Springboks doctor. He's quite involved in rugby in the Eastern Cape at the moment, as well as football. Konrad is quite involved in a lot of musculoskeletal medicine management in his practice. And he's had the privilege of being at a World Cup final for rugby and actually coming out there trumps, which is always nice to give those kind of different experiences. He's traveled a lot within different environments, and recently with the, if I'm not mistaken, the T20 team to the Indian subcontinent recently. So he can give us an experience from that perspective. Then I'd like to introduce you to Dr. Hashendra Ramjee. So Dr. Hashendra Ramjee is a sports physician as well, just like Konrad. He's involved at cricket level, where he's one of the Proteas doctors. He's also involved in football, where he's one of the Kaiser Chiefs doctors. He's involved privately at the Ahmed Katraya Lenmed Clinic in the Sports Medicine Center. And Dr. Ramjee, just like Craig, has been in many, many bubbles thus far. He'll also give us a good perspective on the difference between a cricket bubble, the football bubble, and all the other bubbles on the different continents. Then Cliffy Deacon. So Cliffy Deacon is a physiotherapist. And what makes him more famous than a physiotherapist is he's actually an ex-pro cricketer. And he's played for several franchise cricket teams in South Africa. He's played for the emerging squads. He's played in the UK as well in his younger days. And he also had decided to pursue a career in physiotherapy and developed into this, where now Cliffy is the Pakistan Cricket Board's chief physiotherapist. So he's also been traveling all over the world in different bubble scenarios, experiencing things differently. So as we continue, there's just this one image that I would like to share with you all. And the importance of sharing this image is just to give us a perspective of how little has there been attention paid from the healthcare workers' involvement from a bubble scenario. Now, we all know that bubbles are not easy. They certainly are challenges as well. And if we don't talk about these things, we won't know what our colleagues are experiencing. A lot of us watch things on the background and then think that it's a simple process, but it's not actually. And there's lots of challenges that they face in these bubble scenarios, which often are not spoken about in the public domain. I'm just trying to make my screen share proper. Sorry. For some reason that is not showing, but I'm sure all our people visualizing can see these aspects. So what I've done here, I've taken a couple of slides of news reports and just shoved them on one slide, where all of the time we're talking about what the massive toll shutdown and lockdowns have taken on athletes, the potential issues that may be envisaged in the Tokyo Olympics, info from cricketers themselves about how excited they were when they came out of quarantine scenarios to be in bubbles, the difficulties that people are trying to achieve of getting into bubbles, like India trying to get the athletes to experience bubbles for themselves and explain to them how they need to behave. Issues recently that have started coming up with regards to the IPL, where a lot of players are starting to leave the bubble of the IPL, either scared because of the pandemic that's presently at a surge in India, or unsure whether they will get home or if they want to go and be with their families in these kind of difficult times. Our local players having difficulties as mental health affects them, okay? And also issues with regards to places like Canada, where even their hockey has been affected by all these scenarios. So I think it's quite vital that that we start talking about these kind of things. And the only way that we will know what is happening is if we get it from literally the horse's mouth. And I think there's many scenarios and many situations that we never think about. And the way we're going to conduct all of this is more by a question and answer kind of session. And I'd like to invite Q&As within the block at the bottom here as well. And all our colleagues will give us their experiences in the various bubbles. And Toni will be the glue of the entire thing, being a clinical psychologist. And Toni Gaddie is not only a clinical psychologist, but she's a sports performance coach as well. So she can look at things from a very different perspective. And also just a normal performance coach. So she can give us a lot of kind of tools and perspectives that she would look at from a clinical side as well as a performance side. So to begin the entire thing off, guys, I'd like to just ask you the first question, which I think is most important. How did you prepare getting into the bubble? Now, let me pose this question to Dr. Ramjee first, because he was the first person that experienced the bubble from everyone that's on this here. Dr. Ramjee got into the football bubble, which specifically I was quite involved in developing that whole bubble. And one of the reasons why I never called it a bio bubble was because I realized that the mental aspect of things of being in a bubble can be quite a significant impact. So we called it a biologically safe environment. So trying to create some positivity around the entire thing, which has a more negative kind of connotation. Dr. Ramjee, did you feel you had to mentally prepare for that football bubble when you started off?
Yeah, thanks, Lee, and thanks to everybody who's invited us. I must say, initially, we were fairly unprepared because we didn't know what to expect. And certainly it was more profuse sort of rush to get things sorted. As you can recall, there was lots of testing and lots of procedures that happened before that we were fairly sort of uncertain about. But certainly from a mental point of view, I think we didn't expect or we understood that there was going to be psychological challenges because there were other biosafe environments taking place around the world, particularly in England, where we got a lot of feedback from, we got lots of feedback from other football leagues. And certainly the mental health or the psychological aspect of it was at the forefront. In terms of planning, I must say it was more or less, let's see how it goes. And certainly while we were there, we learned a hell of a lot on the run. And so to answer your question, planning probably wasn't the greatest, but certainly learned a lot as we started immediately.
Thanks. Cliffy, for you in Pakistan, in your first bubble, when was your first bubble experience? And do you think you had planned mentally sufficiently for that?
Yeah, Doc, thank you. Yeah, we were the second team to tour England. We were there just after the West Indies played against England, and like Doc Hash just said, now you try and plan, but if you don't know what to plan for, how do you plan? And I think mentally that is most probably the hardest thing when you go on a tour where you try and plan as much as you possibly can and you don't know what to plan for. Is to mentally prepare yourself to be able to answer questions on the fly, and to be able to adapt as much as you possibly can. And we didn't have a lot of time to get feedback from the West Indies tour against England because we were in the UK while they were playing each other. And so you try and watch what they do, and then you try and simulate that during your preparation phase. And you know, speaking of preparation phase, you don't really know what needs to be done to prepare people properly, physically and mentally while you're in the bubble. So you try and learn as much as you possibly can in a very short space of time.
Craig, you joined Dr. Ash with a couple of tours after he had done the football bubble as well. Have you learned some tricks of the trade from him about how to prepare yourself for your first bubble event?
Yeah, obviously we chat quite a lot. We're quite close in terms of our relationship within the team. So feeding off Doc Ash was important for me. I was just thinking about the questions you're asking now, and we were actually in India at the time when we had to fly back quickly from India with the first case. So then we went into lockdown, and then everyone was all over the place, you know. And I remember clearly that I was calling Doc Ash all the time. What's happening? What's happening? You know. And then we had to prepare again for the tour. So as Cliffy also said, we have to be very flexible in our thinking. It's not cast in stone yet, I think, about bubbles. So we're learning all the time.
Yeah, exactly. Dr. Van Hagen, your experience in the bubble that you went to recently, I think, what was it, about a month and a half ago? Was it something you expected? Was it worse than you expected? Or do you think, okay, it was on par with what you expected?
I think I've got the fortunate part is that I've been around a bit. So there's been different bubbles that's never been called bubbles. So I traveled Sri Lanka in 2006 with the Proteas, and we came back because of the Tamil Tigers that was bombing us. And then 2007, we traveled back early also because of unrest in the country, and the Minister Bhutto was assassinated. So that was different kind of bubbles. So I think I was prepared in a sense for that we can't do anything. And those tours were like 7 weeks at a time. So I think from that side, I was prepared, but also I think because if you are a traveling doctor, you develop ways and means to keep yourself busy. And so for me, it was actually a great experience because I could sleep a lot and catch up on paperwork and run through the other things. So I think, yeah, so I think the big thing is having yourself mentally prepared and knowing that you are ready to travel and ready to do these things, and you are on your own, happy to be on your own. Yeah.
Toni, as a psychologist, I think what I've picked up thus far is that most of the colleagues, some have went in there without any kind of expectations, some have had lots of experience of difficulties, and that it sort of mentally helped prepare themselves. Do you think these past experiences have positively reinforced the experiences in bubbles? Or what's your thoughts on that kind of thinking with regards to bubbles?
So, I mean, what I first want to share is, you notice we all learn from each other, and we all learn from our experiences. And as Dr. Hash, can I call you Dr. Hash? He spoke about we couldn't prepare for lockdown and for bio bubbles because no one had experienced it before. So there wasn't a certain protocol to follow beforehand. And I love what he said around we had to think on our feet and we had to keep learning. And you said you learned very quickly. So most important thing there is around being open to learn for this new experience, which is difficult, but being open to learn. And then as Craig put it, or it was then Cliff spoke about adjusting and how important it was for all of you to be adjustable. And then Craig used the word flexible. So learning adjustable and flexible is so important for any curveball, any challenging new context. And then again, connecting with each other, chatting and connecting with your colleagues, the teammates, and sharing your own experiences and what each other are doing to cope with this very unusual context that we all thrown into. I've never been in a bubble. I've been in lockdown. So that's my experience of trying to relate. I work inside my office online, supporting coaches and athletes in these bubbles. And it's interesting, they say the same thing. There was no preparation. It was ongoing thinking on their feet, learning experience. And then they also reiterated, Konrad, that many said, and especially if they were used to traveling, it was now an opportunity to really get to know the self and get to know what they like to do and have time to do stuff that they've never had time to do when they're training, when they're coaching, when they're working. So that openness to learn, being flexible and enjoying time with yourself is so important for this kind of context.
Fantastic. So it's almost like going to varsity away from home with no contact with family. It's a new experience and trying to learn life all over again. Tell me, did you guys have challenges with regards to your mental and your physical motivation within the bubble? Now, I'm quite certain that initially in the bubble, because it was new and getting used to the system, you adapted quite fast. But as you almost got this bubble fatigue, what's your experience been, Craig, in these kind of scenarios? Because you've been in several bubbles now for several periods of time. What was your experience?
Yeah, the term bubble fatigue is it's used quite a lot recently. We see it a lot with players using it as well. I think when it comes to us, we always have to be on the ball, or we're supposed to be on the ball. That's what everyone thinks that we must. So our front must be quite firm and like as per normal. But it does happen, no doubt, mainly because we don't have that so-called norm to do, because I'm sure Cliffy will allude to me as well. We work long hours, and sometimes it's just nice to know you can go outside and have a cup of coffee at the coffee shop and not be around everyone all the time. So just to get away, and detach yourself, probably that didn't happen. So yeah, I think maybe that was a big part of some of the stuff, the mental fatigue part of it. But from a work perspective, not really. You know, you grind and you keep working. So the time goes by in terms of that. But just to get away, I think that was the tough part of it.
During this time, how had you guys adjusted towards your usual eating habits, physical activity habits, and just normal kind of downtime habits? What was it a challenge, because most guys will end up going to the gym or something of that sort on a regular basis? You're spending so much time within a hotel environment. Yes, you're treating players, etc., but you normally would set aside some time for yourself to do whatever, academic reading, physical activity, and eating healthily. Do you feel that these kind of bio bubbles create monsters, whereas similar in the initial phases of lockdown, where a lot of people started just snacking on a lot of stuff that they normally didn't eat, started doing this year? Cliffy, what's your thoughts on that day, and what was your experience on that?
Look, I think when Dr. Van Hagen said he was able to sleep a lot more, I think Craig and I were chuckling a little bit, because you end up in these bubbles with a lot more players locked in a hotel with you. So you spend quite a bit of time doing work. Now, in a certain way, I think that's a blessing in disguise, because your day goes past, or your day, there's so much to do in your day that the day passes by a lot quicker than, for argument's sake, if a player would go to nets, he would spend 2 hours training, he would spend an hour in the gym, and then what? Then he's got all of this time on his hands doing whatever. So we've got a little bit of a routine where you spend you spend a lot more hands-on work, time on hands-on work, but I think it keeps you sane, because you have a normal day, and I think from that perspective it was a blessing in disguise. So as for the training and the physical and the mental adjustment to spending all of this time, I think it was important for, like, from a personal point of view, to make sure that I stay as healthy and as to keep wellness a priority, because looking after yourself, if you don't look after yourself, you can't look after others. I felt it was really important to, especially eating habits, to make sure that you look after your eating habits. You do get to spend some time out in the nets. I know Craig still bowls a lot at some of the South African players, and you do get some time to be physically active. And then if you do find some time to go to the gym, you do take that time. But I think the eating habits you had to make sure that you look after that first and foremost.
Okay, good. Thanks for that. At least I was going to challenge you on a 2-kilometer time trial run, but now that you said you've been looking after yourself, no, thank you very much. We'll do it another time. Dr. Van Hagen, in all this time of doing the bubbles, etc., tell me, did this give you an opportunity to ensure that you make sure you collect enough CPD points online, so when you do your HPCSA registration, you're all kosher? Did you find it an opportunity to actually do a lot of more CPD events online?
I think we've all done that, in this whole, not even the bubble time, I think in the whole period. And that's where WiSH came in, that I did so many of your WiSH things, and it was great. And it was great for, remember, we now called Govender, so we don't even know where we are, in a different part of the country now. So, and for us being isolated, it's so great to have all these opportunities to have these seminars and get our points. So yes, we did. I didn't really, during the bubbles, no, not as much. I spent more time doing a little bit of my own research with the players on sleep. It's one of the things that I've got a passion for. Yeah, so I think the whole lockdown period, yes, definitely played a role of us getting up to date with a lot more and finding things that you are interested in. But while being in the bubble, I think while you're there, you're more focused on your team and what you need to do and what's important for them to perform.
Fantastic. Toni, what's your thoughts on that? It seems like people have, when you go into these bubbles, you're almost forced to adapt. And I think that's probably a human nature kind of thing. You're forced to adapt to the scenarios and make it as best as you can. Do you think this is something that we as physicians should actually also try and educate our players about and our management about and our technical support staff in future?
Well, I think as Craig commented, that there is something called biofatigue. I mean, we all experience it in lockdown. We certainly experience lockdown fatigue. And so once we've had that experience and we've gone through the process of figuring out what is tough for us in a bio bubble and what works well for us, it would be so valuable to share that information and educate healthcare workers as well as our athletes that we see. I just want to share what's so important with what Craig and Cliff said is that when they felt it was, or when Craig said it was tough for him, he felt he needed to get a break because you're working so hard. You have to know what you need to do for yourself to detach. And that's where it's very important to know how you can clear your mind, how you can get out of this bio bubble in a virtual way, whether it's to read a book, whether it's to meditate, whether it's to watch a movie, whether it's to call family. So it's so important to know what works for you, so that you can divorce yourself from this context, which feels redundant, which seems like it's going on forever. And then Cliff spoke about that we're lucky because as healthcare workers, we're in a routine and we're working hard. And that's very true. But at the same time, when you're working hard, it's also important to know that sometimes you're working so hard. And when you're working so hard, you can fall into bad habits. So some of us can fall into eating badly. Some of us can fall into training too hard. I know for myself, I can fall into training too hard in every moment I get between clients or after clients. So I think it's important that we know ourselves well and what works for us, and we know our weaknesses and what we need to do about our weaknesses so that we can fortify them.
Thanks for that. Now, one of the main things that people are always asking is that as you spend lots of time in this bio bubble, in this isolation, it might even affect your clinical decision making. Do any of you feel that it has negatively affected your clinical decision making because of being in these bubbles, or it's probably made you a bit more astute from your clinical skills? Dr. Hash, what's your thoughts on that?
Yeah, interestingly, Lee, I think certainly when we looked at it the first time, we thought, okay, yeah, we were excited about it, I think. And so there was a lot more happening from a clinical point of view than usual scenarios. I must say, over time, fortunately, we've learned quite a bit in these BSEs, and certainly that I wouldn't say has affected our clinical astuteness, if I may put it, or if you put it that way, negatively. And certainly in a way, it's allowed us to collaborate more. So I'll give you an example. Myself and Gavi have a lot of chats about player injuries, which we were doing anyway before, but we certainly sit down and analyze a lot of things and come up with a lot of things. So in fact, I think in some odd way, there's been some sort of benefit with regards to the interaction that takes place amongst us. Certainly it allowed us to also challenge ourselves clinically, because obviously being in an isolated environment, in inverted commas, does sort of challenge you in terms of the norms that you would usually do, i.e. would send people for ultrasound, send people for certain assessments to specialists, now knowing that you needed to do a lot of that because the bridging capacity was a bit less than usual. So I think the ultimate answer to your question is it didn't, in my case, negatively affect things. In fact, I think it helped, and certainly it was great going forward.
Well, that's good. That's good to know that there was some positive outcomes from these perceived bubbles that are so negatively shown all the time. The other thing that I want to ask you guys, and you've been to several bubbles, etc. Coming out of these bubbles and going back into normal life, back into normal clinical practice, did you find it a bit of a challenge as well, trying to get back to the normal routine of things? Or was it a challenge the first time and then it became easier after the second, third bubble? Konrad, what's your thoughts? You went into one bubble recently.
Yeah, so my bubble, I'm the least experienced when it comes to bubble life. Yeah, no. So from my side, it was still, yeah, it's strange, but I think COVID per se and the fact that we had lockdowns and things made it difficult for us all. I mean, you would have experienced it as well in your practice. I just think, just going back to the previous question with Craig and Hash, is that there's a lot that we learned in that period. So if you look at when we started, now we've got PCR testing, and how much does that mean? And then you've got a player that test positive for PCR and now can't travel, and CT values, and then it's the antigen test. So I think we all learned a lot from a medical point of view and started learning a lot more about how to manage that and get clever about the testing that we've got and how sensitive and what we can do. Then also our player management, and I'm sure Ash will agree, is that you would have one example, a type 1 diabetic that normally we would put in a buddy environment. So you would always have slept with some other player to make sure that because he's known to have hypos. So now suddenly we have to change the way we're managing because he can't. So now at 3 o'clock in the morning, he needs to phone his wife to say, I'm still okay, I'm awake. So that stops his sleep. But that's the way bubble life has changed, medical management as well. So now he phones his wife at 3, but it affects his sleep, which could potentially affect his performance. But that is the important part, is that we had to adapt. And I'm sure there's lots of cases where we did things differently that we would normally have done just to keep that up. Because I was only away for 2 weeks, for me, it didn't make a real difference. For me, it was actually just that nice part to get out of the country and experience normal-ish life, even though it was not normal at all. Now, you understand. It's just to say that, yeah, I've actually been in a plane just after lockdown. So I think I've got the luxury side of it, where the rest of them had a lot harder life than I had.
Yeah. Craig, what's your thoughts on that experience?
Sorry, Doc, can you repeat yourself?
What is your thoughts on your experience of the whole scenario in the bubble? Did you feel depressed at times? Did you feel that it was becoming a bit too overwhelming and it was difficult on returning to get back into a normal routine of life? You've been in several bubbles since last year, so I think you've probably been in the most bubbles compared to everyone else here. What was your thoughts on that?
Yeah, no, I don't really think that. I think the biggest thing which occurred was a family, being away from family for that amount of time, where we are able to probably travel with our spouses when it's longer tours. So when we're going on repeated tours all the time, that gets a bit much, because you're leaving alone your wife for that amount of time. So the family aspect is probably the toughest part of these BSEs. The work is the same, basically. It actually helped because the players can't go anywhere, so they got to come for treatment and do their rehab. So there's no excuses. Yeah. So you're actually benefiting we're getting player benefits in terms of performance and doing the little stuff. But yeah, I think the family part is the tough part.
Cliffy, if I can pose this question to you, did you find it challenging trying to discuss with your management of your teams, etc., with regards to making more equipment available to you that you would normally not travel with, because there were external service providers you could utilize? Now you go into a bubble scenario and you might require your shockwave or this or that or all these things which you thought about before, because you could always use others that were in whichever country you were using. Did you find it a challenge discussing these kind of financial related issues, which is not really supposed to be the medical person's sort of forte, but it's equipment that becomes necessary for medical management in certain scenarios? Well, have you had experiences like that?
Doc, the one thing that we have done is we've been able to acquire some of the diagnostics to carry with us. So, stuff like ultrasounds, etc. But I think our board has been really good. They've been really open to these sort of discussions. And also, I think the logistical planning in the host country, or if somebody was to come to us in Pakistan, is to make sure that there are green zones in hospitals. I think if you were able to have those sorted, and I think it falls under the same banner as you speak about equipment. It is also the infrastructure that's available for teams traveling, and to be able to have those things sorted out and ready and available without breaking your bubble. I think when you go to a board and you speak to them about making sure that everybody is safe, that it's all looked after, that the bubble doesn't break, everybody understands the responsibility that we have initially to make sure that cricket goes on, and to have that in place. I think everybody was really open to have those sort of conversations so that you can make clever plans around it and make sure everybody's looked after as they always would have been if the bubbles weren't there.
Okay, good. So at least you didn't have any challenges from that perspective.
No.
Hash, a question that I'd like to direct to you. With regards to any potential positive cases within these bubbles, etc., what was the kind of stress levels when you were working in these bubbles that you underwent during those periods? It must have been a difficult thing because there's always the contact tracing and this and that and all these kind of things. What was the kind of pressures that you felt about it? Did that sort of affect a lot of decision making, or did you just push that out aside and just imagine that you're sitting in your practice with the patient that has this here, and this is the process we would follow? I mean, I'd like to know how was your mind sort of working through this process?
Yeah, interestingly, Lee, so obviously with everybody may have be aware of what happened with the South Africa and England tour last year, where there was a bit of unfortunate events that took place within that. So we had to sort of again learn very quickly from that, and certainly then going into the next series with Sri Lanka, obviously the planning was almost it was piggybacked off what we had done for England. But why put this into context, or why I'm saying this as an introduction, just put it into context, is that it created a lot of anxiety because we had to know that we were trying to, or we were gonna sort of get through this tour without any blips. And certainly at that time, the Sri Lanka tour was our January or December tour. And certainly, as everybody knows, December was when the numbers started going up again. So, you know, the anxieties around making sure that the tour, one, gets completed, and certainly with that in mind, knowing that we can't have anybody that's positive within the environment. So the anxieties almost started in preparation to the whole tour. And certainly what that was about was getting people who test positive. But what we did was obviously tested more frequently, and certainly it helped alleviate some of the anxiety. But I can still recall the first 3 testing scenarios, i.e. the first 3 tests that we had over this 5 days, the first 5 days. And we sat waiting for results, knowing that, you know, a positive suddenly now hits media, it could potentially damage the tour. So the levels of anxiety were significant. Why this is also important was, one of the things that, as I said earlier, is that we were learning a lot. And certainly one of those things was now starting to sort of look and say, okay, what affects us as technical staff within the environment, and what affects players within that kind of environment? Do players have anxieties around testing? And it was interesting that every time we tested, players also had anxiety around waiting for the result. And certainly, to give you an idea, the first test always is usually where you're in what we call hard quarantine, i.e. you're sitting in your room until the result is available and then you get out. And certainly if I look at the Sri Lanka tour, we had to wait almost 24 hours. When we were in Pakistan, we waited over 24 hours. And certainly you start, then things start crossing your mind, because certainly, for example, the Pakistan one, you're going to be stuck in a room we were in Karachi at the time, and not being able to move. And suddenly you start contemplating all those thoughts, and then knowing that even if you have to quarantine for 10 days, the team's going to move away from you and you're going to be alone. So I certainly think those anxieties were there persistently, but as time went by, you obviously got used to the fact. In terms of players presenting with symptoms, that's another anxiety that you have, because now we sit in practice and we see a person with a cough and a sore throat, and you're thinking, oh my goodness, is this COVID or something else? And certainly initially everything is COVID until proven otherwise. Now I think we're a bit more sensible in our approach, and we manage things a bit more sensibly. And certainly we have a bit more armory in terms of testing, i.e. antigen tests that we keep with us, as well as the PCR tests, which are quite available to us during these tours. So certainly the anxieties have become a bit less as you go on longer in the tour. As Konrad has mentioned, we've learned a lot now about all the finer details of testing. So even when somebody does come back with a positive result, we start looking at previous positives, etc. And these were some of the things that we experienced pre-tour. Some players were testing positive before we went into the tour, and then you found out that there were previous positives, and certainly that's where all these discussions around CT values, antibodies, etc. came into play. So it was quite interesting, but certainly the concept of anxiety, which is now obviously something that's come up, i.e. the depression, anxiety, and certainly, that being the most sort of, I think the biggest psychological aspect of bubbles at the moment.
Thanks for that, Ash. And I think it's important, some important factors that you brought up there about saying how we readjust our thinking, and how us as physicians have learned through these processes over this last year, just over a year, about how to actually manage these kind of scenarios that face difficult decision making. As physios, Craig and Cliffy, most of the time when players are busy being either given a myofascial release or some soft tissue massage or some activations, you guys essentially are psychologists. So you're actually taking some of Toni's work away. So my question to you guys is, did you find within the bubbles that you were in, that you started spending a bit more time with players discussing all these kind of issues? And I mean, often they end up talking about not only cricket related stuff, but personal stuff, etc. Did you feel you started spending more time with them, or getting into their psyche of things, and they actually wanted to share this information with you more than per usual? Craig, if you can give us some feedback first?
Yeah, I think it's quite a normal thing. I think it's not an abnormal thing due to COVID. They probably did discuss more about issues about being in bubbles and family, more importantly. So yeah, it's understanding and relating, I guess. So more being a listener and giving some of your own advice, self stuff that's happening at home as well. But yeah, I mean, there's also a line in the sand that you don't want to cross, and you can't give too much information away as well, you know. So it's trying to understand who you're dealing with and trying to assist them to get better and find motivation, you know, also. But you don't necessarily need a lot of motivation to represent your country at the end of the day. So it's just the pre-match stuff and some irritants that could happen. Yeah.
Lee, if I may, Lee, sorry,
Yes.
if I may, Gavi's probably being a bit modest, sort of in his
Very
trying to
modest.
see, yeah, he's trying to see he doesn't cross the line. So I mean, just personally, I mean, I reflect on some of the aspects where I witnessed Gavi doing work, and he probably doesn't realize it, but very sort of influential in his approach with regards to how he manages things, and certainly in terms of how he says things that influences people's behavior. So we talk about concepts of brief interventions and motivational enhancement, and sometimes just using the right words and saying the right things, or deterring somebody from some sort of behavior that they think is a norm, and suddenly coming into an environment and understanding the professionalism that's associated with an environment and being reminded of that. And certainly then from the outside, like I said, witnessing how players make change because of something that Gavi might have said, which is quite interesting, because now he said something in possibly 2-3 minutes about an individual behavior pattern or approach, and suddenly that has changed, and you can actually see that's better for the player going forward. And certainly that's a learning. So I think he's being a bit modest.
So I think, Toni, I think
Yeah.
from your side, I think what we've noticed there is that obviously from that perspective, it's a lot about individual players' personalities as well that comes into play, together with the medical management and influence from the background. What's your thoughts on that?
Yes, I think what's so useful being a healthcare worker, and especially in bubbles, you can hear how most of us have a little less pressure. Yes, we have the pressure to make sure that our players perform at their peak, but we are on the outside of making that vision happen, representing your country, winning a gold medal, getting a title. And so it's useful for them to be able to share with us. It's almost they will share with us more easily, and then we will be able to direct them or nudge them in the right direction. And absolutely, it is all about the individual personalities. You notice how for some in bubbles and speaking about athletes, they will feel watched, they'll feel paranoid, they'll feel provoked, they hate being cooped up, and it's a struggle for them, and they really need to share with whoever their support team is. So having a physio who will listen, a doctor, or whoever is objective, who they trust, is so valuable. And then you get ones who keep to themselves and use their own routines, and they're very happy to be on their own, and their routine works, and they're pretty automated in their routine, and they go on with their own business. So yes, it's so important to be able to tune in to the different personalities, and know what works for all the different athletes. And at the same time, that comes from you being able to tune in to yourself and knowing what works for yourself as a healthcare worker. So you can, as one of the guys mentioned, we also expected to be on the top of our game. So we have to tune into ourselves and check that we are really taking care of ourselves, so that when they do come to us, we're not fatigued, we are able to be on the top of our game.
Fantastic. Cliffy, a question for you. with regards to these bubbles, at any point, did you ever feel guilty? Now, when I'm talking about guilty, when you went into this very protected space where there is minimal chances of you being infected by COVID-19 because of all the massive protocols and bubbles and control mechanisms in place, whereas family members, significant others, etc., are all still outside in the public, just trying to make sure they follow the basics of protective measures. Did you ever feel guilty about not being around them and trying to protect them? Because at the moment, that's one of the scenarios you see that's happening in the IPL. We got leaving the IPL bubble simply because of either those reasons of not being around their family during these bad times that's happening in India, or other guys being worried about if there's a complete lockdown on flights going out, they'll never be able to get home. Did you ever have some kind of a guilt feel within yourself during your bubbles?
Doc, I don't think I've ever felt guilty about it. I think we felt a massive sense of responsibility. And also, you know, you kind of feel fortunate. So to backtrack a little bit is when lockdown in South Africa happened in, when is it, last year, we were all kind of forced to spend the time with family, and you know that at some point in time this lockdown is going to stop and you're going to have to start doing what you do. So I think the time that we were able to spend with our families in lockdown in South Africa gave us the time and the opportunity to plan and to discuss these sort of things, so that when we started working in cricket again, they understood what our responsibility was towards the game and towards the players. We had the peace of mind knowing that we have discussed all of these things, communicated all of these things, and that, you know, that part is taken care of, because, you know, you had so much time to take care of these sort of things. And if you didn't take care of that thing, I think then there would have been a thought of, or a feeling of feeling guilty. But I think, you know, I certainly haven't felt any sort of guilt. Very fortunate, and also a massive sense of responsibility to make sure that we look after the sport we all love so much.
Okay. Konrad, I'm not going to ask you to respond to that question, because you've got big kids, so you must have been happy to at least disappear for the 2 weeks. Dr. Hash, if I can ask you to maybe,
I think I would like to agree with him. Yeah. I would still like to agree with him in the sense that what I enjoyed was the fact that the responsibility taken by players and by management and everyone, and not only in cricket, in soccer and in rugby, is everybody realized that we've got a responsibility to get the game back on, get all the sport back on track. So you had a moral and a personal, we needed to, because people's lives depend. If we don't continue, people aren't going to have a salary anymore. They're not going to do. So I was very proud of the people that were going into the bubbles and saying, listen, we're going to make it work. And I think Cliffy, you and Craig and Ash, you were the guys that did that. So so it's a special environment and a special time, and it's a different responsibility, and you guys took it and went with it.
Hashen, your thoughts when you came out of your bubbles and went back into other bubbles all the time? Did you find that your kids were asking, "Who's this guy that's in the house?"
You know what, Lee? Obviously, the virtual platform of video calls, etc., have made the world a very small place. And in fact, we had this conversation while we were in one of the bubbles I had it with one of the team managers, and it's interesting. And as Konrad had mentioned, that when they were touring the subcontinent in the early 2000s, or mid 2000s, there was long tours and it felt like isolation. But then they didn't have video calling, etc. So to answer your question, video calling has made a big difference. I managed to do some of the kids' school homework while I was in Pakistan with them on the phone. So it does make the world a smaller place. So to answer your question, when I got back, they were more sort of, this guy's back. Because now we have to listen to, he wasn't there and shouting at us, but now he's back here and shouting at us. No, but it's an interesting dynamic that when you do return, your family, the fact that you miss so much of the family, they become your focus over that initial period. And then, the real world gets back in and you just get back into it. And certainly, I think that, all the ability to have video calls and certainly, the way we do conferencing, etc., has now made the world a very much smaller place and possibly has reduced a lot of those family or strifes that we had in the past.
Fantastic. I mean, I'm happy to know that with regards to all your experiences, these bubbles are actually, you've had challenges, etc., but I think the social moral responsibility, like all of you have mentioned, that we have for looking after these athletes have taken precedent, and we haven't allowed that to sort of take over anything else, and we've managed it as healthcare professionals quite well. Toni, I'd like you to take over with your presentation that you were going to go through with us, if you don't mind at this point.
Sure, I think Robin is going to share. Okay, so it's true. It's so lovely to hear how all the guys presenting tonight seem to take it in their stride and use what works for them, whether it's video calling, whether it's finding ways to adjust effectively, exactly what I'm going to speak about. Then again, at the same time, I think we do go through struggles, and we're human beings, just like the athletes, just like everybody else. And I think it's also important for us to be aware of that and to be able to acknowledge it and speak about it. So I'm just going to share with you a model, which is a model which I use for myself as well as for my clients. And it's based on my passion, which is sports champions. Robin, you can move the slide. Okay, and that's just, for me, my context, of course, is not in the bubble per se, but it is really supporting the athlete who is anxious in the bubble. And so I learn from them vicariously and hearing what they need. And I have to support their provocation. And as we spoke before, how they all individually provoked. And it's my job to tune into each one and find the best tools for each one of them to adjust to their new context, because each bubble as a traveling athlete is totally different around the world, and they all need time to adjust to them. And so, yes, that is my context. I'm just going to move my slide here down. So the model that I use is based on my passion. So as a little person, I was always fascinated with champions. I wanted to be a champion. I was an ex-professional tennis player. I wanted to win Wimbledon, and I did play professional tennis, but I did not win Wimbledon, and that is why I'm sitting here today. And the way I got provoked and the way I can relate to bubbles is through lockdown for myself. And during lockdown, just like Dr. Hash said, initially it was a strained environment. Before lockdown, before bubbles, we navigated our narratives very easily with our life and our work. And when this catastrophe of COVID hit, it affected all of us directly or indirectly. And for me to make sense of it, like we spoke about the anxiety of the athletes and the anxiety of getting COVID, that was incredibly rife during the initial stages of lockdown. And for me, I noticed the way I got provoked was through nightmares of anxiety and fear. And I felt, to imagine if I'm having these nightmares, I can imagine what my clients and family and friends are having. And so I started to make sense of that by writing. And I always draw on the whole champion model, my model that I've learned over the years by working with athletes and my fascination with champions. And for them, what they do, I looked at what they do in these foreign contexts that they constantly exposed to. And it's so interesting because the healthcare workers tonight are not like healthcare workers like myself who stay put and who work from their offices online with traveling athletes. They also are exposed to all these different contexts, most of them. And so it's interesting how they've also learned to adjust, like sports champions have learned to adjust to these new contexts that they are exposed to month in and month out. And I looked at champions and I looked at sports athletes and I looked at how they use their teams, they give themselves time to adjust to a new context, a foreign context that is not the same as the context before. And what most importantly is each athlete gives themselves time to adjust and acclimatize and find a new routine. But as it was said tonight, and what I felt, it's so important for us to know our strengths and to know our weaknesses as well, to know how we get provoked and how it manifests. And to go back to the whole champion model, over time in my practice, I became much more interested in what I call whole champions. And whole champions were just athletes who were not only successful in their fields of expertise, but they also over time showed to be successful in life and in work. So in other dimensions of their lives. And I noticed the reason for this is because they don't only amplify their strengths, they also own and look at their weaknesses. And because they're so comfortable with their weaknesses on the field and off the field, they know how to fortify them. They know how to adjust their weaknesses, adjust their mental tools and their routines so that when they're exposed to a strained foreign context like they are month in and month out, they know how to adjust in a non-judgmental way. They give themselves that time and that space. And so during lockdown, that was my way of identifying with all these guys in the bubble, and as well as my athletes who I am supporting. And I noticed that initially I could use champion an athlete's routine, which I applied to myself. So initially during lockdown, it was quite harmonious for me. I worked hard and I peppered that hard work with giving out to my family. I call it the 4 M's, with meditation in the morning, working, finding time for exercise. Movement is the 2nd M. The 3rd M is music at night to relax. And then the 4th M was managing information and relationships, as well as my clientele. So those 4 M's, that model that I just emulated, champions use a model or routine when they're traveling in foreign contexts. So for lockdown or my bio bubble, I used that model. And for a lot of the time it worked. It worked for months. I had a nice juggle going. But then I noticed as a healthcare worker, we tend to sometimes work because we need it, because it's such a responsibility. And exactly what the guys have spoken about tonight. We do feel privileged to be able to get our athletes back on track, back competing, because this was their livelihood, and COVID, it threatened every sports person's dream. And so it felt so fantastic to be able to support them in now allowing them to compete internationally. At the same time, I found myself quite sucked in to writing more articles, supporting more, seeing more and more clients, getting really, really busy. And for me, when I get really, really busy, that's when I become vulnerable to my weakness. And my weakness, when I'm overworked and overtired, I'm unable to be totally present and totally contained to support my client. And I discovered that one night when it was toward the end of lockdown, and I felt, I didn't realize it at the time, but I was pretty burnt out. I was training really hard. That was my way of getting release after many hours of sitting down. And I noticed that after a client who was not only struggling to keep his dream alive, locked down in a very hard context, but he was struggling to keep himself alive in that context. And that was a very tough session for me. And after that session, I couldn't be so supportive. And I could feel that I really needed support. And that's when I got my supervision. I allowed myself, I spoke to colleagues, exactly what these guys have been saying. That is absolutely essential, is speaking to colleagues, connecting with multidisciplinary teams. Immediately I draw on my supervision. I actually go to physio. That's very useful. And so for me, I had to acknowledge my own vulnerability when I became tired and burnt out, overtrained, and drawing on that support and giving yourself time to adjust, exactly how a sports champion does when they travel the globe. They give themselves time to adjust when they are provoked by a different context, by maybe even a more strained context. And I had to look at what script I was internalizing around how much I should be working, should be giving out, should be delivering. And I edited that toward what I need to be doing. And that was healthier for me to be able to be totally present and supportive, because this is, as we've said, a privilege, a responsibility to allow our athletes to compete to the best of their ability. And yes, giving ourselves time to grapple with new routines, new tools will be so essential going forward for BioBubbles, because we are learning all the time. It's going to be different in different countries. One of my clients who just recently came out of a bubble spoke about how for her it was so controlled. It was it's so exhausting to be constantly tested, constantly watched, that she became angry and not really anxious, but paranoid at all these people watching her to check that she's doing the right thing to keep everything safe. And so navigating the right internal narrative script around why they're doing that. And we settled on they're doing that to keep her safe so she could compete. And that at the end of the day is the most important thing, is for us as healthcare workers and as athletes to keep our eye on the prize. And the prize is to compete. And we do have to find new tools and new routines to adjust to this new way of healthcare working, this new way of competing internationally. But I think we could, once we get the hang of it, we find a new, healthier routine for ourselves, when we're able to really honestly look at ourselves and see what works and see what doesn't work so well, and then find other ways to navigate what doesn't work so well, so we can be our happier, healthier selves, as well as be there for our clients. Yeah, so just to end, I'll end with one of my heroes. I don't know if anyone can guess who my hero is as a tennis player. It's, I won't even try that. It's absolutely Roger Federer. And I'll end with Roger Federer because he is the whole champion I base a lot of my research on. And he is so forthcoming with his emotions, with his weaknesses, which is why he can contain them so well when he needs to perform at his peak, just like we need to perform at our peak to take care of our clients. And it's interesting how, because he's so okay with his emotion and with his vulnerability, not only in private interviews, but to the media, interviews after Wimbledon, after winning titles, it's easier for him to figure out how to navigate his struggle and how to fortify his weaknesses when they come to the fore. So he says, I have a statement in my mind, which I always use as an example. He in an interview, he shares how they're asking him about nerves and anxiety. And they say to him, you have won so many titles. Surely you're not nervous before final anymore. And he says, I get sweaty hands, I get excited, I get nervous. I have to remind myself that I have to remind myself of what I've done. Can you believe Roger Federer still has to remind himself of what he has done previously? And he has to remind himself that he can believe in himself at each point. And then he says, of course I get nervous. I'm not a robot. I'm just a human being. And on that note, I'll end. And yeah, thank you so much for your time. I really enjoyed listening to these esteemed professionals. The way you've navigated the bubble is inspiring. It's really inspiring. And I'd love to share some of your experiences with my clients, because I think it will be very valuable for them, especially the ones who are so experienced in these new strained competing contexts. Thank you.
Thank you very much, Toni. I think that is quite an insightful talk that you've just given us. And I think it just hits home quite nicely for all of us to realize that in all these adverse kind of environments, if we just look deep within ourselves, we're able to function as long as we have that ability to do so, and we look at the purpose of what we're doing everything for. And each person's an individual, and each one will have their own approach. And I'm so happy that our healthcare workers have looked after themselves in these bubbles. I just got a few questions. Most of them have been answered already, but there's just a few questions I'd just like to pose to colleagues just to get their views. Dr. Mintz, he's asked us about how do you create a green corridor for hospital visits? And I think this was brought out by Cliffy. We mentioned that's what they do there in Pakistan. So firstly, what I would like to just mention to that is that even in South Africa, most of our hospitals have a COVID-free zone, but it goes through a certain process. And I think that certain process is important, where there is a via the casualties, where they do assessments, evaluations, etc., and patients are triaged accordingly. And I think that's how you create these kind of green corridor kind of environments. Even your radiology departments would have COVID-free X-ray departments, where ones would be only for COVID patients, etc. So, Dr. Mans, I hope that answers your question.
Lee, if I may, I can add a bit just to give you some insights on how it was managed in cricket. And certainly from a South African context, you're absolutely right about the green parts of, or non-COVID parts of the hospital versus the COVID parts. And certainly if we look at December as an ideal scenario, i.e. when COVID and hospitals were extremely busy, the hospitals were really good in that when we spoke to the hospitals, and we try and create the so-called bridging concepts, i.e. from the BSE or bubble that you're in, and trying to move in your transport bubble and create another mini bubble wherever you're going to. And how we manage that with the hospitals, with the specialists, and particularly radiology, is certainly looked at radiology departments that were not hospital-based. That was our first priority. And certainly there are some that exist with full-on MRI capability that are not in hospitals that assisted us, and it worked excellently because we were the only people. It was arranged such that when we got there, we were the only people that were there, and we came through a separate entrance. And certainly all the only person that was helping us was either the radiologist or the radiographer when doing MRIs, etc. And they were in full PPE, and everything was done in a sort of sterile manner. And certainly when we had players needing to see specialists, etc., we negotiated with the specialists prior to the series. So it was all part of the planning. Again, something which we learned from before, and now planned a whole lot more better, that we've negotiated with various specialists, not only looking at certain things. So we looked at knees, ankles, shoulders, fingers, hands, all of those things, and said, right, these are the specialists, spoke to them upfront and said, if we call you, these are the requirements, will you be able to sort of help us out? And certainly the guys all came to the party with regards to this. So that's how we created those bridging concepts, and really worked well. And I must say the hospitals and all the specialists, particularly in Joburg, were very helpful. We did experience the scenario in Pakistan as well. And interestingly, it worked the same way. In Pakistan, one of the things was the guys going for MRIs, and certainly the hospital phoning us and saying to us, look, the radiology department's busy at the moment. Do you mind coming as soon as we close at around 6? And that way it will be empty and we'll get everything done. So we moved things a little in terms of how we would do it compared to how we do it before, but we managed it. And certainly everybody is aware from a health professional point of view.
Fantastic. Thanks for that, Hash. Then Dr. Patel. Dr. Patel worked as a MO in one of the bubbles in KZN. And his question is the following after his discussions with many people in those bubbles about the mental fatigue that has been experienced. So he's asking that with the potential of people getting vaccinated, etc., do you foresee these bubbles going on for the next couple of years? Or do you perceive that these bubbles may still continue, but at a lesser stringent kind of mode that we've been doing it at present? So I don't know, Konrad, maybe you can add something there.
Yeah, that this we've had these conversations before, Lee, is that we really don't know. This is a unique environment and a unique time for all of us. So we don't have a thing that, earlier in this week, there was 900,000 new cases, the highest ever in the world. And in South Africa, we're in a comfortable place where we don't have that currently. So this virus is changing, chopping and changing and doing what it needs to do. So I don't think we can look into a bubble and say, this is what's going to happen. I just think we need to take it day by day, get more people vaccinated, still practice common medicine, look at the symptoms, test the guys that we need to test, and then we have to see. I don't know. My personal feeling is that at this moment in South Africa, we're okay. We had such a bad second wave that in the Eastern Cape, it was terrible. I recall myself we discussed it. Not wanting to sleep at night because I know how sick the people are and my patients are, and you don't know how to cope with everything. And then now we're at where it doesn't really exist anymore, but it's there and it's not going to stay away. It's going to come back, and we all need to be clever. So I think we don't have an answer for that. No, I don't think we can say yes or no. No.
Yes, your thoughts on that?
Yeah, I've obviously been challenged with that question a lot, and Yusuf had done some good work in the 2 domestic series BSEs, and certainly it was an extension of all of that, where we were then seeing players. And the first one was what is the impact of vaccines going forward? And certainly at the moment, like Konrad says, we don't really know. We don't know how it's going to affect things going forward, particularly in BSEs, where we want to try and protect an environment, because it's so important that a series gets completed. However, again, as I said earlier, I think what BSEs are doing is allowing us to be a bit more dynamic in our approach, and understanding that the basics of risk mitigation are important, and certainly learning what are now becoming the more prevalent risk factors to getting exposed to COVID-19. One of those being traveling, and certainly gathering with a lot of people. So we're trying to be a bit more dynamic in our thinking, and saying future BSEs certainly may be somewhat of an inverted commas norm. However, how can we now create certain bridging processes which are safe in the context of keeping people at a low risk, knowing that we can never, even within our BSEs, make risk zero, but try and manage it so that if, for example, and certainly this is something that we're grappling with, for example, guys want to play golf. And how do we manage that? Knowing that, okay, if community incidence of spread is low, the golf course is an outdoor area, knowing that we wouldn't have to interact with anybody if we negotiate with the golf course owners or the management, can the guys play golf? And it could potentially become a situation. Could we consider guys going to shopping centers and say, okay, when are the quietest times that shopping centers are the shops open? So say a Monday morning at 9 o'clock, saying to the guys, okay, if you do want to shop, there are usually no cricket games on a Monday morning. We'll take you whoever wants to shop. Here's the opportunity to shop between 9 and 10. And certainly this will be the scenario. So these are all thoughts that are going through our mind as medical guys who plan DSEs and plan protocols. However, from a patient, player perspective, they just want the answer. Is it going to carry on or isn't it? And certainly then you then get to the New Zealand and the Australia concept, where you quarantine for 14 days and then you move freely after that. But Cliffy will give testament to the challenge that a 14-day scenario is in a room. So I think that is where everything lies in terms of going forward. As much as we want answers, like Konrad says, there's little that we can offer, but hopefully we offering information that we are trying to address the challenges, and that seems to alleviate some of the stresses that the players are experiencing in terms of saying, okay, this is what the future holds in terms of touring or traveling.
Yeah, and I think that's important, that we just keep informed, we keep everyone informed of the necessary information on decision making, etc., which is still going to be safe for everyone to continue doing what they love to do from their career perspective. So I think it's wonderful what you guys are doing there. We've got an anonymous attendee.
Sorry, Lee, while we, can I just butt in there? Is that, yes, we are in our situations, but like the animal farm situation where not all pigs are equal, is that not all BSEs are equal. So we must also recognize that. And I think Hash will agree with me, is that you've got a perfect environment that you try and put up, but it doesn't always work like that. So you must realize that you as a medical professional in that environment will need to make sure that what needs to happen, and it doesn't mean the governing body where you're traveling are actually doing everything right. Simple things like, now you're traveling back from Pakistan to South Africa, what happens in that 24 hours that you're on airports? How do you manage that? So then you're out of your bubble, but you go back into the next bubble, but so much can go wrong there. And so, and I think Ash will agree, he warned me about when I went to Pakistan and said, be diligent. So make sure the rules are followed, because it's so easy that the rules aren't perfectly followed.
Yeah, so Dr. Patel, I think the sweet and short answer there is that bubble will probably continue, but will probably change its perspective as more information and more knowledge base becomes available. So that's it. An anonymous attendee has asked a very interesting question. So they said lots of people have learned new skills and hobbies, etc. during lockdowns. Have you guys learned anything during these kind of scenarios? I know what I've learned to do is I've learned to stitch a button on a shirt. Have any of you learned any other new skills?
Wow. And that's a skill not even a woman can do.
Lee, we've practiced, even though we haven't been able to get to a golf course, we've practiced our short game quite a bit. We're fortunate enough, we've damaged the hotel lawns, but yeah, we've practiced our short game quite a bit. So yeah, I think the next time I get to the golf course, short game is going to be good. Don't know about the putting, but the short game is going to be good. Braai skills, I think there's some guys that are developing braai skills, players mostly, because they get made to braai. And then, yeah, I'm becoming a culinary genius, i.e. tasting and can tell good food from bad food.
Okay, that's good. Well, just one last little funny quirk here from Gino van Dijk towards Gavi. asking you, Gavi, that has your bowling improved with the extra time you've had?
Yeah, it's actually improved my knee. I'm doing more rehab and it's helped get my knee better. So yeah, definitely.
Okay, fantastic.
It's showing he needs a bit more work on his action though.
Yeah. Put more work on the action.
Well, colleagues, I thank you very much for heeding the call to come to this talk so we can share more of this kind of knowledge that you guys have experienced in this last year in these bubbles. I think it's vital that all the other colleagues know what you experience and what your challenges are, etc. And I think information sharing like this does not always necessarily have to be a academic session, because unfortunately there's no academic research based on healthcare workers' experiences into biobubbles, not as zero papers, so sometimes these discussions are just as informative as everything else. So I'd like to thank you all again for joining us this evening and being part of this whole process and discussion. And I hand you over to Dr. Saggers, who will introduce the next WiSH talk, which will be presented by Dr. Ponki Farah about PF instability and pain. So please do join the WiSH group when this information is shared further on. It'll be quite an interesting talk by a leading knee surgeon that will be happening. So again, thank you, colleagues. Thank you, local and overseas colleagues who have joined us. And we wish you all well with the next future bubbles, and knowing that we have our teams in good hands, and also knowing that you guys are top notch in what you're doing. So thank you very much, everyone.